My name is Justin Harshorn. I'm a student physical therapist. For educational purposes, are you okay with me recording today?
Yes.
Perfect. So what I want to start with is called the Hoffman sign, just a test on your finger to test if you have any impairments in your upper spine. Is that okay with you?
Yes.
Perfect. So if you can, go ahead and give me your hand. All right, so I want you to stay nice and relaxed here. Go ahead and perform the test. Good. So what I'm looking for here is some abnormal movements in your pointer finger and in your thumb here. All right, that'll give me a positive sign. Good. No impairments. All right, so now I want to move on to some joint mobilizations in your thoracic spine. Is that okay with you?
Yes.
All right, go ahead and lie down with your face down there. And place this up underneath your legs here just for comfort and to keep your spine in neutral. All right. So I'm going to start here just by finding the spine of the scap, the rear scapula. That'll take me over to T3. All right, so I'm going to start with some central, posterior to anterior joint mobs here. Good. Is there any pain with that?
No.
I'm going to move over to the transverse process and do some unilateral to help with some gliding movements. All right, any pain with that?
No.
Perfect. I'm going to stay on that transverse process. We're going to do some transverse glides. Good. Any pain with that?
No.
Perfect. I'm going to slide down to the inferior angle of the scapula. It's going to take me over to T7. I'm going to come up one level to T6 here. Same thing, central, posterior to anterior. All right, is there any pain with that?
No.
Good. Coming over laterally. Now using the rule of threes, I'm going to come down half a level for the transverse process. Good. Some rotation. Any pain with that?
No.
Perfect. All right, I'm going to stay right there. We're going to do some transverse glides. All right. Good. Any pain with that?
No.
Good. I'm going to come down, find your 12th rib. All right, trace that up. All right, T12, same thing, posterior to anterior. Any pain?
No.
Good. Unilateral, now I'm going to come down a full level using the rule of threes for the transverse process. Unilateral rotation. Good. Any pain with that?
No.
Good. I'm going to stay there. We're going to do some transverse glides. Good. Any pain with that?
No.
Awesome. All right, now to help with some thoracic right rotation, because it's right rotation, we're going to be working on the left side of the spine to help with that. So I'll come back up to that T7, find the inferior border. Good. So in that T7 region, again, I'm going to use that rule of threes, half level, come over to the transverse process. All right, now I'm going to start with a grade 2, and we're going to do 3 bouts of 30 seconds. Depending on the patient's tolerance, we can decrease that to a 1 or increase it to a 3. All right, so I'm about 0 to 50% right here. Again, this is going to help with right thoracic rotation. All right, was there any pain with that?
No.
Perfect. So of course I would perform that, like I said, for three bouts of 30 seconds. Now to give you an exercise to help with that, go ahead and sit up on the edge of the table for me. What I want you to do here is you're going to sit up nice and tall, place your arms across your chest, and then you're going to just rotate to the right as far as possible. You want to keep your hips straight towards the camera. Good. Hold that and then come back nice and smooth. Perfect. So I want you to do that for 3 sets of 10 reps with a 2-second hold at that end range motion. All right. Do you have any questions or anything for me?
No.
Perfect.